Good morning, good afternoon, or good night, everybody, depending on the time you are watching this training video. In this training video, I will go through the procedure of phlebotomy and recommended order of draw of samples. The information given in this video is based on the WHO guidelines and the reference is given in the slides. You are welcome to go through this document for your reference. Please go through this training video according to your convenience and do the pre and post MCQ questions online for your knowledge check and our record. The link of these quizzes will also be communicated to you by suitable channels. I hope you will learn something new after going through this training. Please feel free to send me any queries if you have on my email. Now, first of all, we need to have a proper location depending on the setting where we are doing this procedure. For example, in the blood sampling room of an outpatient department of an hospital like ours, we have a dedicated phlebotomy cubicle which contains a clean surface with two chairs, one for the phlebotomist and the other for the patient. A hand wash basin with soap, running water and paper towels, alcohol hand rub. Now, in case you are doing this procedure in the wards for IPD patient at the patient's bedside, please draw the bed curtains to offer privacy to the patients. Before you even start the procedure, make sure there are documented clear instructions for the blood sampling in a laboratory form. Now let's see the procedure of drawing blood. In step 1, you have to collect all the equipments needed for the procedure and place it within safe and easy reach on a tray or a trolley, ensuring that all the items are clearly visible. Now the equipment required includes a supply of laboratory sample tubes, that is the vacuum extraction blood tubes, well-fitting non-sterile gloves, a tourniquet, alcohol hand rub, 70% alcohol swabs for skin disinfection, gauze or cotton wool balls to be applied over puncture site after the procedure, laboratory specimen labels, writing equipments, laboratory forms, leak-proof transportation bags and containers, a puncture-resistant sharp container. Ensure that the rack containing the sample tube is close to you, that is the health worker, but away from the patient to avoid it being accidentally tipped over when the procedure is being done, as the patient may be in pain and can respond reflexly. Now you have to identify and prepare the patient. If the patient is adult and conscious, follow the following steps. Introduce yourself to the patient and ask the patient to state their full name. Check that the laboratory form matches the patient's identity. That is, match the patient detail with the laboratory form to ensure accurate identification. Ask whether the patient has allergies, phobias, or has ever fainted during previous injections or blood draws. If the patient is anxious or afraid, reassure the person and ask what would make them more comfortable. Make the patient comfortable in a supine position if possible. Place a clean paper or towel under the patient's arm. Discuss the test to be performed and obtain a verbal consent, which is very important. The patient has all the rights to refuse a test at any time before the blood sampling. So it is very important to ensure the patient has understood the procedure. Now let's come to the selection of site. Extend the patient's arm and inspect the antecubital fossa or forearm. Locate a vein of a good size that is visible, straight and clear. Now this picture shows common positions of the vessel, but many variations are possible. Now the median cubital vein lies between muscles and is usually the most easy to puncture. Under the basilic vein runs ulnar artery and ulnar nerve. So puncturing here runs the risk of damaging the nerve or artery and is usually more painful. So do not insert the needle where veins are diverting or taking a turn means, because this increases the chance of a hematoma. The vein should be visible without applying the tourniquet. Apply the tourniquet about 4 to 5 fingers width above the venipuncture site and re-examine the vein. What you will do in case of hospitalized patient. In these patients, do not take blood from an existing peripheral venous access site, because this may give false result, and this will nullify the whole exercise. Hemolysis, contamination and presence of intravenous fluid and medications can alter the results. So please be careful before taking the blood. So as suggested before, apply a tourniquet about 4 to 5 finger widths above the selected venipuncture site. Now perform proper hand hygiene using soap and water and dry hand with single use towel. After that, put on well-fitting non-sterile gloves. Now let's see how to disinfect the entry site. Now clean the site with a 70% alcohol swab for 30 seconds and allow to dry completely, like for almost 30 seconds. Now apply firm pressure, but gentle pressure. Start from the center of the venipuncture site and work downwards and outwards to cover an area of 2 cm or more. Allow the area to dry. Failure to allow enough contact time for alcohol will increase the risk of contamination. Do not touch the clean site. In particular, do not place a finger over the vein to guide the shaft of the exposed needle. If the site is touched, repeat the disinfection process. Now let's see the procedure of venipuncture. Anchor the vein by holding the patient's arm and placing a thumb below the venipuncture site. Ask the patient to form a fist so the veins are more prominent. Enter the vein swiftly at a 30-degree angle or less and continue to introduce the needle along the vein at the easiest angle of entry. Once sufficient blood has been collected, release the tourniquet before withdrawing the needle. Mind you, this is before withdrawing the needle. There are some guidelines which suggest to remove the tourniquet as soon as blood flow is established and always before it has been in place for 2 minutes or more. So mind you, don't put the tourniquet for more than 2 minutes. Now withdraw the needle gently and apply gentle pressure to the site with a clean gauze or dry cotton wool ball. Now ask the patient to hold the gauze in place with the arm extended and raised. Do not ask the patient to bend the arm, because doing so can cause a hematoma. When obtaining multiple tubes of blood, use evacuated tubes with a needle and tube holder. Now this system allows the tube to be filled directly using vacuum. All additive tubes should be filled to their stated volumes. Tubes with the anticoagulant clot activator must be gently inverted 10 times end to end to prevent clotting. Next, you discard the used needle and syringe or blood sampling device into the puncture resistant container, followed by checking the labels and form for accuracy. After that, you can remove the gloves and place them in the general waste. Perform hand hygiene. If using soap and water, dry hands with a single-use towel. Now, when obtaining a blood specimen from a catheter, the components of the blood collection system, which are catheter, lever lock, syringe, and needle and collection device, should be checked for air leaks, which may cause hemolysis and incorrect draw volumes if overlooked. Now, collection of blood through lines that have been previously flushed with heparin should be avoided if possible. One must avoid sampling through an indwelling catheter. But if in some circumstances the blood must be drawn through an indwelling catheter, possible heparin contamination and specimen dilution should be considered. The line should be flushed with 5 ml of saline, and the first 5 ml of blood or 6 dead space volumes of catheter should be discarded. Draw samples in the correct order. It is very important to draw blood collection tubes in the correct order to avoid cross-contamination of additives between tubes. Plastic serum tubes containing clot activator may cause interference in coagulation testing. Only blood culture tubes, glass non-additive serum tubes, that is the plain glass tubes, or plastic serum tubes without any clot activator may be collected before the coagulation tube. First, we will start with the blood culture bottles. Now, they usually contain broth mixture to grow microorganisms for various microbial tests like antibiotic sensitivity. Now, after blood culture tubes, glass non-additive serum tubes or plastic serum tubes without clot activator may be collected before the coagulation tubes. After this, we will collect samples for coagulation tests like prothrombin time, which has using a light blue top color tube. Now, this type of tube has sodium citrate, which forms calcium salts to remove calcium and prevent clotting. Next, we will use clot activator tubes for tests in chemistries, immunology, and serology, as well as blood bank. Now, these tubes have blood clot activator, which promotes blood clotting, and serum is separated by centrifugation. Next, we can use gold color top tube, which contains gel at the bottom to separate blood from serum on centrifugation for test in chemistries, immunology, and serology. After that, green color top tube, which contains sodium or lithium heparin that inactivates thrombin and thromboplastin, can be used. Also, light green top tube with additional gel separator falls under this category and can be used. Following that, purple top color tube which contains EDTA that will form calcium salts to remove calcium can be used. Next, we can use pale yellow color top tubes which contain acid citrate dextrose that inactivates complement, and this can be used for tests like HLA tissue typing, paternity testing, or DNA studies. Finally, grey color top tubes which contain sodium fluoride and potassium oxalate, which is an anti-glycolytic agent to preserve glucose, can be used for testing glucose. Please keep in mind to gently invert tubes with additives to mix thoroughly, because erroneous test results may be obtained when the blood is not truly mixed with the additive. Please use the right size needle for blood sampling, because if you use the needle that is too large for the vein for which it is intended, it will tear the vein and cause bleeding, that is hematoma. If the needle is too small, it will damage the blood cells during sampling, and laboratory tests that require whole blood cells or hemoglobin and free plasma will be invalid. So it is very important to use the right size needle for blood sampling. Drawing blood specimen from an intravenous or central line is another factor which can result in hematoma. and there is a risk of possible heparin contamination and specimen dilution. So this should be avoided if possible. Some other factors that increase the risk of hemolysis are underfilling a tube so that the ratio of anticoagulant to blood is greater than 1:9. Mixing the tubes too vigorously, so this will again increase the shearing effects and can increase the risk of hemolysis. Failing to let alcohol or disinfectant dry. Leaving the tourniquet on for greater than 1 minute. So these are some of the common factors that will increase the risk of hemolysis. So please try to avoid them. These are some of the references I have used in this presentation. You may, if you wish, you can go through them.